of the border's quarantine protocols for Trinidad and Tobago. So again, we go back to the definition, which is the cornerstone of vaccinated versus unvaccinated persons. A fully vaccinated individual is considered so 2 weeks after having or receiving the final recommended vaccine dose or doses of a WHO-approved vaccine. The approved vaccines to date from WHO are Pfizer-BioNTech, AstraZeneca Oxford, Janssen, which is the Johnson & Johnson, Moderna, Sinopharm of the Beijing plant, and Sinovac Coronavac. So the categories, passengers from all countries, we broke it into 3 categories. So you have the first category, unvaccinated individuals, and just a note there, this category applies to nationals only. You require a PCR test 72 hours prior to arrival, which will be validated by the airline. Immediately after arrival, you go into state-supervised quarantine for 14 days, medical assessment within 24 hours of arrival, daily monitoring, and a COVID-19 PCR test done on the 7th day of your quarantine. Asymptomatic passengers who test negative are allowed to go home after the quarantine period, and passengers who test positive are immediately transferred into the parallel healthcare system based on your acuity of the disease at the point in time. Just a note, asymptomatic passengers testing negative on day 7 still have to complete the 14-day period within the designated facility. Retaining passengers requiring immediate medical attention, whether it be coming in by air ambulance or becoming critically ill while at the quarantine site, they will be allowed to go to any quarantine hospital where they get care. These are non-COVID positive, so they will go to possibly another facility, have their care. If it is less than the 14 days and you're well, you can go back to the facility thereafter. Stable patients being transferred back to the state-supervised quarantine facility. Passengers who test positive for COVID-19 upon arrival or during quarantine are again transferred into a facility at the parallel healthcare system. Fully vaccinated passengers. PCR test 72 hours prior to arrival. Proof of vaccination, WHO-approved vaccine. No quarantine required. Category 4, children. So unvaccinated children traveling with a vaccinated parent or guardian are allowed home with the following conditions: a PCR test 72 hours prior to arrival, repeat of the PCR test between days 3 and 5 of arriving into the country, which will be required that test is to be sent to the office of the county medical officers of health at the various counties. Of course, if you're positive at that time, you'll be isolated, contact tracing will be started. Any unvaccinated adult traveling with a child will go to state-supervised quarantine as per Category 1. Unvaccinated children traveling without a vaccinated parent or guardian will also go to Category 1, which is state-supervised quarantine for the 14-day period. Prime Minister, that's the end of the presentation.